All right, thank you. It's just right at 7 a.m. and I'll call to order the Thursday, December 17th meeting of the Eastern Idaho Board of Health. We welcome all the public that is online with us at this time. It is being viewed on our public health YouTube channel and can also be streamed and watched later in the day. So we appreciate our director setting that up for us. There's also a room available at the building of Eastern Idaho Public Health for any public that desires to attend the meeting at the building location. We welcome all of our board members, appreciate each one of your attendance this morning, as well as all the staff with Eastern Idaho Public Health. We'll go ahead and do a roll call this morning. Our physician, Dr. Nelson.
Barbara Nelson, present.
Thank you. And Teton County.
Bill Lake, present.
Fremont County.
Lee Miller, present.
Madison County.
Brent Mendenhall, present.
And Jefferson County.
Shane Young, present.
Clark County.
Greg Shanton, present.
Lemhi County.
Ken Minor, present.
Custer County.
Wayne Betts, present, and Merry Christmas to all of you.
Merry Christmas, Commissioner. And I'm Brian Reed from Bonneville County. We have a full slate of board members this morning, so again, appreciate your attendance. We'll go ahead and begin with our approval of our December 10th Board of Health minutes from last week. We do appreciate Cheryl O'Connell and all that she does to prepare these minutes and have them ready for us at each of our meetings. She does a great job in recording all the events, and so we appreciate her. Has everybody had an opportunity to review those? Are there any changes that are needed? Hearing none, I entertain a motion.
I'd make a motion we approve the minutes.
Barbara Nelson, second.
Thank you. We have a motion and a second to approve the minutes from December 10th. All in favor, say aye.
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 Is there anyone opposed? All right, thank you. The public comment portion of our agenda this morning, we received a few comments this week, not very many. Most of them were related, as I read them, to the vaccine with questions about them. Some had concerns about them, expressing their reluctance to take them, and others that were very excited and wondering how that can be facilitated to receive the vaccine. That will be discussed later on our agenda today. We are excited about the rollout that's been happening this past week and all the work that's been going on at East Idaho Public Health to be able to distribute the vaccine that they are receiving. We do appreciate all the comments that we receive. We consider each one of them, read each one, and again, appreciate those that take time to send in their comments in a way that will be helpful to us. We'll go ahead and move on next to a report from our regional healthcare partners. And we'll begin with Eastern Idaho Regional Medical Center. Mr. Hoffenberg, welcome this morning. Thank you again for being here.
Good morning. Can you hear me?
Yes, we can.
Great. Well, just wanted to give an update, on our COVID numbers. Right now, we have 40 COVID in the hospital, 13 in the ICU. The ICU has 25 patients, so 13 of those being COVID, and then 16 of our total ICU patients are intubated. I'm sorry, I don't have the number exactly of how many of the COVIDs are intubated, but 16 of the 25 total. But over half of our ICU census is COVID positive. Beyond that, we are very excited to report that yesterday and the night before, actually on Tuesday evening, we administered our first vaccinations at the hospital. So far, we've administered about 150 to our staff of our initial allotment, and we appreciate the public health department. We have around 2,500 to provide over the next few weeks, and we'll have gotten through about a quarter of those, hopefully by early next week. So we continue to roll that out, and we've had no adverse reactions to the vaccination. And in fact, you know, the scene that we had on Tuesday night with the staff was just pretty remarkable. It was what we would call pure joy. Just incredible thanks and gratitude from the staff. Very happy times, lots of energy, and folks are just, I think, excited to have what, you know, we see as the light at the end of the tunnel. And for our staff, and seeing that we've continued to have folks get sick and have to go in quarantine, that this is a way to end that, but hopefully be the start of what we see as really the slowdown of the spread of this disease in our community. So beyond that, ERMAC is doing better with staffing. We continue to hire new folks and get them off orientation. We still are not out of the woods as it comes to our nurse staffing. We still have needs that we are trying to fill. And throughout the region, that's the story we are hearing from all of our hospitals in our hospital co-op, that everybody is short-staffed, particularly critical care and ICU nurses. So we are working hard to get that group. They're amongst one of our first to get the immunization. So we have them all inoculated at this point, and then we continue to work through our team members, and we're tiering them based on their risk factors and exposure to COVID patients. So or hopefully in the next 2 to 3 weeks before the end of the year, have every one of our staff members and physicians vaccinated. So that is exciting news, but you know, we continue to treat our patients and do all we can to care for them the best we can, and we just hope the numbers start to slow down a little bit more over time.
Thank you very much. We appreciate that report, and we too are excited that those members of your medical community that have been working so hard with all the COVID related patients, that now they do have some protection. So we too are very grateful for that. We'll go ahead and move then to Idaho Falls Community Hospital. Mr. Jackman, thanks for being here.
Thank you. Good morning.
Good morning.
I am optimistically happy this morning. For the first time in 2 weeks, we have more non-COVID patients than we have COVID patients in the hospital. I currently have 19 total in the hospital, 8 of which are in the ICU, and all 8 are intubated. We did acquire 4 more ventilators, so that gives us a total of 14. We currently have patients from Bonneville, Bingham, Jefferson, and we still have that one from Eugene, Oregon with us. She's in the ICU. We also started the vaccines this week. Our staff kind of took a wait and see approach to make sure nobody had bad reactions, and it really picked up yesterday. We did have one minor reaction. An employee developed a fever of 102, which resolved within 24 hours. We have been able to vaccinate quite a few, including 27 physicians who seem extremely excited about this, and we're glad to be able to provide that. Like David, we're still fighting a little bit with some staffing shortages, but we have been able to acquire a couple of travelers and have hired several nurses in the past couple of weeks. So with our numbers trending down a little bit on the COVID side and our numbers trending up on the staff side, we're breathing a little bit easier right now.
Well, thank you. We're very glad to hear that report and that you have been able to catch a bit of a breath. And we appreciate you and all of the hospitals and all the work that you have done to hire more staff and try to stay as fully staffed as you can during a difficult time. We as a community are grateful for you and the work that you've been putting in.
Thank you.
We'll go ahead and move to Madison Memorial. Dr. Gonzalez, welcome this morning.
Good morning. So at Madison, we're actually the last couple days back to what I would call our typical census around this type of year inpatient wise. And I will say that we currently have no inpatient COVIDs. However, I have to be very clear, the last two that I'm aware of were transferred, one to Idaho Falls, and we had a 29-year-old that needed to be transferred to Utah. And again, it's the type of care that these individuals need. So just because we currently don't have any inpatient doesn't mean that there aren't some around. The ER has been busy. The outpatient, I hear from the physicians the continued relief for the treatment for the monoclonal and polyclonal treatment, and believe that that's helping. Again, we've got small numbers, so I can't really say that that's valid statistically, but certainly it's been helping a lot. We average, anywhere from a dozen on up on that treatment on an ongoing basis. And of course, the vaccines, same thing, doing a great thing as far as instilling hope, lots of questions. And we completed the last injections of the first allotment of immunizations last night. So we've given all of those immunizations to all of our staff at this point, and we're very excited to see the next round coming next week. So thank you, everybody.
Thank you. We appreciate your report. It was exciting to see those vaccinations begin up at your hospital last week, from what I understand, the first in Idaho, I believe. And so we were fortunate to receive that in our health district and excited to see it in your hospital. So thank you for that report. Are there any questions from board members or any of these hospital administrators?
Mr. Chairman, if I might, this is Brent.
Go ahead.
To all three of you, I've kind of watched the active cases. Do you feel you can actually attribute a rise in cases from Thanksgiving? Have we made that connection? We probably have, but I just wondered, for the public's sake, have we seen a dramatic increase as a result of Thanksgiving? Do you think we can tie that at all?
This is Casey.
Commissioner Menden. Oh, go ahead.
I was going to say, I can't speak for the others, but we definitely saw a spike after Thanksgiving. And we expect another smaller spike after Christmas, but we definitely did see quite a rapid rise about 5 to 6 days after Thanksgiving.
Yeah, I would echo that.
Okay, and I thank you for that. Mr. Chairman, I think the reason that I brought that up was just anyone who is watching, or any of the public, be wise. I would never say don't visit your family and don't give your mother a hug, but be so wise with Christmas coming on. Just a reminder from us, there was a spike, and I saw that, and I wanted to hear that from these professionals. So thank you.
Okay, yeah, thank you. Any other questions?
Mr. Chair, this is James. May I ask a question?
Of course.
To Dr. Gonzalez and Casey or David, if you'd like to comment as well. Monoclonal antibody treatments, do you expect more, and how is your supply of those treatments?
We're getting a regular shipment of both. And so I don't know if they come weekly, but how often they come, but we've not run short. So we've been doing pretty good on getting them and administering them.
Yeah, we at ERMAC, we have plenty of supply. We actually are, because of the inclusion criteria, haven't given as much as we would have anticipated yet. Like Rachel, our numbers are relatively small. It's a small group of folks that really do qualify or in the best usage for that. So given that, our supply has been steady and we've not had any issues as of yet. We're still on our initial allotment that we got from the state.
This is Dr. Nelson. I just needed to mention that Dr. Nathan and Dr. Buick-Trigo's office are doing a study, and they will get the brochures over to Eastern Idaho Public Health so we can inform the public about that.
All right, thank you, Dr. Nelson. And maybe you can answer this. Who does qualify for the monoclonal treatment? It was mentioned that it's a small subset that is able to do that. What does it require to be able to qualify to receive that?
I can't answer as to the study. They have specific inclusion criteria. I'll turn it over to the hospitals for their criteria.
As I recall, the basic criteria is there's a small window once they've been diagnosed, and I can't remember the exact time frame, but I believe it's starting at within 5 days of onset of symptoms to 10 days. And they have to have symptomology, but no increased use of oxygen. So if they weren't on oxygen, they're not needing it now. If they were on oxygen, they don't need more than they normally need.
Dr. Gonzalez, would you have anything to add to that? And are you continuing to see positive results from it? I assume you are.
Yeah, the only thing I would add is also it's high risk. And so, you know, above 65 and there are certain criteria as far as what puts you in that high risk category to qualify for it. And yes, our physicians are reporting. Again, it'll be interesting to see the studies that come out on this, but reporting, and they believe that it's helping prevent some of our admissions to the hospital. But it does have to be timely from their first onset and diagnosis. And so from our perspective, David was alluding to, if it were broadened more, I think, you know, we would be able to give it to more patients, but we need to see the data to see for sure on that.
Okay, thank you. Again, we appreciate all of you and the time you take on an early morning each week in your busy schedule. So we appreciate it. We will move on to our COVID-19 vaccine update by our Director of Clinical Services, Amy Gamet. Good morning.
Good morning, Chairman. And so the hospitals have talked about this a little bit already this morning, but yeah, we were excited on Monday to administer the first COVID-19 vaccine in the state of Idaho. Our health department and a hospital in the Treasure Valley both received the first shipment of the Pfizer vaccine. We did get ours just a little bit sooner, and so our hospitals were able to start. We got that vaccine about 9:30 in the morning, and by that afternoon, we're able to distribute that to most of the hospitals in our district and start vaccinating our healthcare workers. So yes, it was very exciting. This is just the breakdown of that week one, the doses that were allocated to our hospitals. So I just wanted to kind of give everybody that picture. We still don't know our doses for next week, but we'll just continue to follow through with the breakdowns to cover that first priority group. This was just kind of a reminder. I've showed this slide or some version of this slide multiple times. This is the first priority group for the state of Idaho, healthcare personnel and long-term care facility staff and residents. CVAC did go in and kind of sub-prioritize them, separated some of these that were combined prior. And again, we're looking at this first group initially.
May I ask you a question on that? So
yes,
when do you anticipate in the senior living facilities for them to begin vaccinating?
And so they did enact that or flip the switch, I guess is what they were calling it, on the 14th of this month to move doses from Idaho's allocation to the pharmacy partnership agreement. So they should be starting the week of the 28th. We could be, some of them that we're doing, depending on how vaccine rolls out, we could be doing some as early as next week. That's best case scenario, but I would anticipate the following week, which is great news as well.
Yes.
So this is kind of in line with some of the same stuff that you were just talking about, is what do our next 2 weeks look like? So we are anticipating Moderna to have their EAU, just like Pfizer did last week. FDA is meeting, actually, as we sit right here, they're meeting right now. The ACIP committee will meet this weekend. So we should know that by Sunday. So next week, I already talked about some of the Pfizer vaccine being shifted to those pharmacies to go into the long-term care facilities. So for us here at the health department, we should have a little bit less of our Pfizer doses, and likely starting next week, we'll have our Moderna doses coming in. Again, that's if everything works today, Saturday and Sunday. So great news as well. I was thrilled with how quick the approval process after that was done, how quick we had vaccine in our building. So just a few questions. Chairman Reed talked about a few questions coming in. So I wanted to try and answer a couple of those. We are working with a physician potentially of putting, some of those frequent questions coming in, a web version of it, and try to have that posted on our Facebook later too. But we'll continue to try and answer those questions as those come in on the vaccine. And questions are good. People always talk about vaccine hesitancy. No, and I think questions are great, and I would encourage people to look, to reputable places for the answers to those questions. I've been doing that for weeks, right? Researching and trying to follow through with those questions. So the first one is, how do we administer a frozen COVID-19 vaccine? The answer is we don't. So a lot of talk about the ultra cold vaccine coming. So how do we administer that? And you can't, there's no way to draw it up. We have to warm that up first. And these are just a breakdown of Pfizer and Moderna, both their vaccines. The Pfizer vaccine can be kept at room temperature for 2 hours and the Moderna at 12 hours. So we have to basically thaw that before we can even dilute the Pfizer vaccine and then administer it. So we don't bring that right out of the freezer and try and put that into somebody's arm. Next question is, how long will vaccine immunity last? And we're hearing a lot about this, and it's complicated. We don't know. There's a lot of things we do know, though, and I'll compare it to some other vaccines that we have. So one thing we do know is antibodies aren't the only thing that has to do with our immune system protecting us. And so even if we don't have a detectable antibody on some diseases, that doesn't mean that we aren't protected. So hepatitis B is a great example of this. If I had my vaccines 20 years ago, if you drew an antibody titer right now, you probably wouldn't pick up that antibody titer in my blood. But that doesn't mean I'm not protected. We now know that if that disease is introduced into my body, my antibodies kick up and still protect me. So we've learned that over time. The next thing we know is having antibodies don't also necessarily mean that I have immunity. We know with other diseases like varicella, I might have to have a high enough antibody titer to protect me from that disease. Something else we do know is if I get a disease, that natural immunity varies depending on the infection, and then it varies from person to person. And that's just historically. So how are we going to learn all these things? We're getting the question not just on the vaccine, but also on the disease. So the one thing right now is CDC is establishing criteria to look about reinfection of SARS-CoV-2 in people. They're looking at how to actually go in and type that and do specific things to confirm or deny that we're having reinfection and how often that's happening. So that's already in the process. The other thing is from the vaccine, those first trials were in July 2020, and we have some data from those individuals that were in those early trials almost 6 months ago. Again, they still have antibody levels, but remember, I just told you, we don't know if that means that's going to protect them, and they're not seeing disease in those early vaccination. Again, those first vaccination, though, numbers were so limited, it's probably not enough of people to determine that vaccine's lasting 5 months. And so we also don't have that data. So the trials are going to continue to be monitored farther out. to see how long those vaccines will last. And this isn't new. Historically, I was looking back at several of them, and I talked about hepatitis B, but MMR, when I got one MMR vaccine as a child. I would suspect most of us, Jerry might be younger than the rest of us, but I would suspect most of us, that was our schedule. In 1991, we learned that we needed a booster dose of MMR. Now every child gets 2 doses of MMR. And so that schedule changed as we learned that information. The same thing with Tdap, the pertussis component in that. We used to think we were done with that vaccine as a child, and we now know that we need a booster dose of that pertussis component as an adult. And so it's a hard question. That's a hard question. And to try and answer that, 9 months into a pandemic, 6 months into a vaccine, there's no way. But I think they are working to answer both of those questions. As studies go out on the disease and the vaccine, we'll learn more of that as it comes in. I mean, the one thing I can say is natural immunity looks good for several months out, and sort of the vaccine studies as well. So the next one that we had come in, one of them was, will the COVID vaccine give me COVID? The answer is no. None of the vaccines developed in the US have the live virus that causes COVID. Basically, the goal of them is just to teach our immune system how to build those antibodies without having COVID. There are cases just like flu, we see it all the time. Any vaccine takes a couple of weeks to work. And so there's a chance that just before or just after receiving any vaccine, you could be exposed to that disease and still come down with it. I think we see this case. We give millions of doses of influenza vaccine every single year. And a lot of those are during influenza season. And so we'll see somebody get a vaccine that likely already had exposure to influenza and then come down to that. I suspect that there'll be people that may say the same thing around the COVID vaccine. So what side effects, and you heard the hospital talk about some of these. Most common side effects are pain at injection site, fatigue, headache, and muscle aches. They typically are being reported during the first week, usually on the second and third day following the vaccine dose. We are seeing that they're less reported in older recipients than younger recipients, which is unusual compared to COVID. It's just the opposite. So I think for our long-term care facility residents, I think this vaccine will be tolerated well. And again, a lot of information come in, as Chairman Reed talked about. And so we are adding a vaccine, COVID-19 vaccine information to our webpage. This is all very new and likely to change fairly quick with all the new information coming in. They'll probably, I just know it's in version, Jerry's in process of changing that. But for now, that information's on there and you can click here and get to some resources. I think that's it for my update. Any questions?
Mr. Chairman, may I ask Amy a question?
Yes, go ahead.
Amy, I'm just wondering, how long do they need to wait between doses, between the first dose and the booster dose?
So it depends on the vaccine. So Pfizer is 21 days, Moderna it will be 28 days. And they're not interchangeable. So whatever vaccine that somebody receives for their first dose, that's the same vaccine they're going to be required to receive for their second dose.
Other questions?
Mr. Chair, may I ask Amy, please?
Go ahead.
Amy, do you guys, do we foresee the public health districts administering these vaccinations anytime soon?
Yes, we do see us. Hopefully next week or the week after into those long-term care facilities that aren't partnered up with other pharmacies currently, and some other healthcare worker groups. Then as we expand into some of those larger groups, essential care workers, I think you'll see lots of partners at the table as the vaccine becomes more readily available. So I think you'll see pharmacies, other hospital clinics. But yeah, I think initially right now we'll begin actually going out and providing vaccine as soon as next week or the following week, depending on what Moderna does.
Great. Thank you.
Oh, general public, I know, I had a hard time hearing, sorry. Sorry, and then the second part of your question about the general public. Again, one of those other $1 million questions, we initially had said 6 months. Likely, just with the rollouts going, I would suspect much sooner than that, early spring.
Amy, a question I've got is we've heard a couple of reports of a small reaction to it. We heard one this morning from Mr. Jackman. Is that unusual? Do you see that in all vaccines? And why is that? Why might someone have a reaction?
We don't, actually any vaccine can cause a reaction, but we do see some vaccines causing more reactions than others do. And I think a lot of it has to do with how they're made or how they reproduce that antibody, make those antibody levels. And so the technology around this one, it causes a great immune response, which I always say is great. Even in little kids, a little bit of a fever means their body's producing antibodies. And so this technology around these first 2 vaccines that are coming out is great technology. It works very well. And I think that's why you're seeing that maybe more common side effects for that day or 2 right away. So it's a good thing that vaccine's working very well. But I do think this is going to have more common side effects versus just our regular influenza vaccine. Again, they're mostly mild, and on that 2nd and 3rd day, and then are great after that.
The second question I had is, I'm sure there'll be some logistical challenges when you receive the Moderna and you're having to handle 2 different vaccines. The governor said yesterday that the Moderna may be more in the rural areas because it does not need the hyper freezer. Can you help us understand how you're going to balance that and be able to manage the 2 vaccines?
Yeah, so a couple things have happened. The pharmacy partnership agreement, so that's the pharmacies that are going in and doing the long-term care facility, made part of that decision for us. So they're going to use Pfizer vaccine. So what's coming into us will be mostly over the next few weeks, the Moderna vaccine, which is, you're correct, it doesn't need to be stored in an ultra cold freezer. It can be stored in a regular freezer. So that's going to be easier for us to get out to those satellite facilities or offices because it's easier. It lasts longer at a refrigerator temperature and lasts longer at room temperature as well. Versus when we break open a box of our ultra cold Pfizer vaccine, basically, and give that to the hospital, they have a 5-day window to administer that vaccine. I'll be able to transport the Moderna vaccine, and they have basically 30 days that you can administer that. So it definitely is much more compatible to providing clinics in our rural communities. And then I just wanted to add one more thing, if I could, onto the safety. Everybody that receives a vaccine will receive a Be Safe information sheet, and that allows them to go in and report any adverse events that they're having. So basically, they can report that daily for the first week, and actually can go in and report that they're not having any as well, or once a week for 5 weeks. And so again, we've never done that with any other vaccine. We've never handed a sheet and said, hey, can you call us if you have a little bit of a fever or a little bit of a sore arm? So they're actively looking for any of those adverse events. And they're looking for triggers, or, as thousands and millions of people are vaccinated, if there's something that maybe wasn't caught in those initial vaccine trials. So again, I think it's being very closely monitored, and we'll have data very quickly.
All right.
Mr. Chair, Bill Lake.
Go ahead, Bill.
Amy, a question we have is, what is the schedule flexibility on the second dose? I mean, it's either 21 or 28 days, depending on the vaccine. What happens if you get it later or earlier? Can you give us some info on that?
So there is a window. What's going to happen if you don't get it is the percentage, how well it works is going to be less. I mean, there's some efficacy on the first dose, and so not getting it all is going to lower that. And then same thing, just following that second schedule may change that. I mean, that studies are done around what typically occurs in that. Real world though, do we get vaccines late? We do. I mean, we do. And so everybody's going to be encouraged to try and schedule that. On the good side, 3 weeks or 4 weeks isn't a long period of time. It's probably easier to keep somebody on that schedule versus hepatitis A that I have to give in 6 months, following the first dose to the second dose. So I think it'll be easier to keep people on that schedule. But I know we're going to have people come in that are just going to get a single dose. They're going to have some protection, or they're going to come in, a few days late on their second dose.
So is it up to the individual to keep track of that schedule, or is there a reminder, or how's that going to work?
It is, but we have tools available. I believe the V-Safe has a text in it. James, do you know that? Has a reminder in it as well. And then just people that we are able to, when we go in and vaccinate in our system, we'll also be able to send out a reminder or actually be able to schedule that right at the first dose for your second dose.
Okay, thank you.
Any other questions? All right, thank you.
Thank you.
Well, we appreciate all you're doing. We'll go ahead and go to our COVID-19 update, our director and our epidemiologist.
Thank you, Mr. Chairman. I'm going to turn it over to James to just start talking about it while I pull up the website for us.
Yes, as we talked earlier with the hospitals, we have had a decrease in cases and somewhat of a little bit of a roller coaster of cases in the last week to 10 days. And, we did see some initial cases from the holidays and from Thanksgiving. With our increased testing capability in the region and more timely testing, those tests not taking a week to 10 days at times to come back, and much shorter than that, including with antigen being some rapid antigen being the same day. It can be, the peak can be a little bit earlier. We're hopeful that these decreased cases continue. I think Commissioner Mendenhall said it earlier, and I would just support his statement in that while we're really encouraged by the vaccine starting to roll out, and we're encouraged by the decrease in cases, we want individuals to still be vigilant and, to borrow a sports metaphor, maybe finish that fourth quarter of this pandemic, that we can continue to be safe so that we don't see a rapid spike in cases. So continuing to be vigilant in their activities and in their safety measures that they've built into place for each other. I'll just point out, as Jerry's pulled this up, you can see over on we haven't shown. Oh. In that lower right screen, those are the case counts that we've seen. And late last week and early this week, we did see kind of a real dip in cases. Exactly what to attribute that to, I do not know. We sometimes see lower cases on the weekends, just as there's many clinics that are not doing testing and sending them in right then. We're relying on probably a few days old material getting into the electronic system. So we at times see lower case counts on the weekend, but the ones that on the Thursday and Friday and Monday, those are somewhat perplexing. But again, encouraging. We would love to see less cases as long as that correlates to less disease in the community. is what I would say. So if you'll go to slide 2 there, the county level, I just want to quickly look at just a few of the counties, and I'm not going to go through each and every one. I would just say that this is Bonneville County. No counties as of today have met a metric to be under the 15 per 10,000. Besides Lemhi, which we looked at actions last week. So none have met the 14-day requirement that you solidified in the plan to be lowered. And as such, will be at least 14 days from today before any of those actions would be taken. We do take action between red, yellow, and orange, or yellow, orange, and red, I should say, as it does happen. And as they meet the criteria to do that. One question that we've had a few different requests on, if you'll go to and one we don't like to focus on, the death demographics. But I did want to just talk through this just briefly. As we've had more deaths, sadly, we have had more ability to provide information that's not that would not indicate the individual or keep their privacy. So you can see again in the top right-hand corner, you can select an individual county, or you can select a combination or all of them. Right now we'll select Bonneville County just for a trial, as though they're the first, and it will update all of the numbers on this page. So Bonneville County has experienced 98 COVID-related deaths, and the rest of this information again updates. The age group, you can then click by age group, and again all of these will update and highlight. The darker portion is what is attributed to that, and you can see the lighter portions are all because we do have the case fatality ratio. I just want to say that's something that we've added just recently. 0.5 to 1.0, that's less than 1%. And that is of known cases. It is not of the population. So it is of known cases. We run at right now at 0.80%, or just under 1% of known cases have passed away. We get many questions about how COVID is different than flu. That is a large difference right there. Case fatality ratio for flu is closer to 0.1%. So you can see that of known cases of this, we're approximately right now, 8 times worse than flu for the fatalities. So that is broken out by county, or you can select all again, and you'll get the total for the districts. And again, the case fatality ratio is just always shown by district. It's not shown by each individual county. I'd like to point that out. There is a little information section right there by that that you can pop up and give you an kind of a more detailed or an explanation, excuse me. So those are kind of just 2 highlights. Again, showing demographics. Go ahead, Jerry.
The case detail. I wondered if you would explain the difference here with the cases.
On the numbers, yeah. So because there is a slight difference in the number of cases on this detailed case information. To help really protect individuals' privacies, we've excluded 90-year-olds from this data. That is because we've increased the ability to see and drill down into specific details of where they might live, cities, or some of those information. And as such, we did not want anyone to be, we have to protect individuals' privacy once again, and it's a core of what we try to accomplish. as such, we've excluded 90-year-olds from this detailed case information. So you'll not see necessarily where they live. As you can imagine, there's fewer 90-year-olds amongst us, and in some cities and counties that could be quickly identified as individuals with COVID. So due to that, we've excluded 90-year-olds from this data, and that's why you'll see just a slight difference in the total number of cases right there compared to our overview. So 18,336 compared to 18,260.
Does anyone have any questions that you would like to talk about on the dashboard?
I would like to just point out how glad I am that those numbers are down the last few days for whatever reason it is. That has been really good news to see. And of course, we'll hope it continues. And, you know, we're glad for the somewhat more positive report from the hospitals, and, you know, just appreciate what everybody is doing out in the community to do their part to help keep people out of the hospital and help slow the spread. So just great to see those reduced numbers. We know there will be bumps probably in the future, but we'll be glad for each and every day that the numbers are down. So thank you for all that work.
Mr. Chairman, may I just make a couple of other comments?
Yes.
We have talked about the surge testing that East Round Public Health is doing currently in connection with the U.S. Department of Health and Human Services. That testing has been going on this week. We have a location in our Idaho Falls office parking lot where people can come and get free testing. That will continue as long as we have test supplies left. We were provided with 10,000. I don't know as of today how many we've used, but a good portion of those were used with some partnership with the INL and testing that they did of their employees. But we have seen that the demand for the testing has not been overwhelming. So again, that's another indication. Is there potentially less disease circulating? And certainly that's our hope. We do know that other testing resources over the holidays are going to be diminished as well. So did you want to talk about Express Farm?
Yeah, so certainly as holidays are coming on, some providers will not have as available options for testing. And I think the testing that we've opened up here can help fill that in that gap. As we've talked with Express Labs, who's been a great partner in the community and doing many of those tests, they're actually, as of last night, was their last night in the Rexburg that they have open and they'll close that through January 4th. So January 4th, they'll open that testing back up. And then this next week, they will also be closed on Christmas Eve and Christmas and through that weekend. Due to that, we also expect to see some lower numbers, I'll just say, coming out of those. Those may not be truer lower numbers of disease rates, but just to point that out, that there may not be as many tests being conducted over the Christmas holiday, and we'll expect some lower case counts, right in that weekend, right after Christmas, and right that first part of that early next week. We're hopeful that individuals get the information they need. Again, we'll say that on our website, there is information. If you do feel that you may have been exposed, you can go to our website and either see a written or a video statement in both English and Spanish to help educate individuals on what their next steps might be, even if they have not been able to seek the testing that they want to. But I'll echo what you said, Mr. Chairman, and that we are thankful for some lower case counts, and we hope that that trend continues and that is reflective of the disease that's out there in the community.
And I would just add one last comment, as Commissioner Mendenhall stated, that with the holiday gatherings, please again just do so safely so that we can keep those the disease spread minimized as much as possible.
Okay, thank you. Are there questions?
Mr. Chairman,
Go ahead, Commissioner Miller.
I've had a couple of people ask a question referring to the CDC's determinations of the isolation periods. Have we adopted that, the new scenario where it went down to, I think it was to 10 days or something like that? Have we even, is that something that we would continue to do as we always have, or we change that?
So, Mr. Chairman, if I might.
Yes.
Yeah, Jerry is actually showing up on the screen, that webpage and that written guidance that we just talked about. And we have adopted those options for individuals that would like to. And you can see that on that written guidance, we've given some examples of even how to help individuals calculate that.
Okay.
If we're not able to get a hold of them.
Okay, I'll let those people know, and then so they can understand it. Thank you. I appreciate it.
And Mr. Chairman, again, I just want to show you one more time where this information is. Right here on the main page of our website in this blue box in English and Spanish. If you just click on there, it does have written guidance as well as videos for people that are positive for COVID-19 or someone that is a close contact.
That's great. And I just point out, I look at every website of health districts in the state and appreciate what you have done here, because it is by far the most easily navigable and has the most information.
May I just make one comment, and Amy referred to it earlier. You can tell as more and more information becomes available, we're just adding that to our front page, and it is quite extensive, and a lot of things get buried here. So probably over the next week, you'll see a change in this with a link to coronavirus information, and it will just go to a separate page that is easily to navigate for testing, for contacts, for vaccine, and with our dashboard. So just anticipate a small change in the display of our website in the coming days.
Okay, are there any other questions or anything else, Jerry?
No, that's all we have this morning, Mr. Chairman.
So just a couple of things. Somewhat sadly, we're anticipating probably a change in a couple of board members this next year. We've heard that from Fremont County, and Commissioner Minor, I know that you are going to be having a change in your life from your position of commissioner there in Lemhi County. Do you anticipate continuing on the board, or will the county appoint someone, one of the other commissioners?
We had a meeting this week. Commissioner Barcelow, who will be stepping in for me, is going to be gone for about 4 to 6 weeks after our first meeting in January. So as of right now, I'm going to stay on and continue to represent Lemhi County until he's back in full force.
All right, well, we're glad to hear that. We appreciate the service from both of you. And your service will be missed, and the experience that you have and bring to the board. We do plan to meet at our next meeting on January 7th, and would hope that both of you are there then. It sounds like Commissioner Minor will for sure, and Commissioner Miller, we would hope that you would be there as well.
Yes, I will.
Maybe your last meeting, and we would probably like to recognize you a little more at that time. So that will be the next time we'll meet, on January 7th at 7 a.m. Before I close, are there any other items that board members would like to bring up? Okay, well, I would like to just give a sincere thank you from myself and certainly all of the board to Director Rakow and all of her staff. We know many of them are going to be working through this holiday season, and we just continue to appreciate all that you do for our community. we hope that somehow you'll all find some peace and rest during this holiday season. I hope that everybody has a safe and joyous Christmas season. I'm certainly thankful for where we are now. We've come through a long several months and difficult things for many in the community. So I'm just grateful that we're where we are now and we can see some light coming at the end of the tunnel. I'm certainly confident of a brighter future in 2021, and I'm looking forward to that. If there isn't anything else, I'll just wish you all a Merry Christmas and look forward to seeing you all on January 7th then, if not sooner. So thank you, everyone. We'll close this meeting.
Thank you.
Thank
Merry
you.
Christmas.
Thanks, everybody.
Thank you and Merry Christmas, everyone.
Thank you.